Okay, once you have done your custom fields, then you can create your template. Because the template is where you're just kind of lining up the custom fields the way you want them to be. So you do the same, go to settings, then medical, and down to chart templates. And you can select new. And just name what you would like for it to be. I would just allow everyone to use it. It's quicker than going through and selecting just specific people. You can uncheck all of these, but if you don't put anything in there, then it remains blank. But allowing this will pull from previous charts, so their allergies will pull over and their medications will pull over. And the chief complaint is where I like to use the variables, so you can put in their name, their age, and that way it will automatically fill in that Mary, age 5, female, is here for her preoperative clearance. And then with the HPI is where you want to put your questions. So if you go down to the subjective custom fields and click that, this will bring up all of the custom fields for the subjective. And we just select which one we want. So procedure clearance, you put that in there. It has all the questions. And if you would like to fill in a physical exam, you can go ahead and also do that here. I'm going to leave it blank because I'm not sure, what all exam that y'all do. But if you just wanted to do like a quick one there, you could. Diagnosis codes, and you click those to add. Two. This system puts unspecified codes in red, so it wants you to not use those because it is unspecified. But you can still use them. But if you see them in red, they want you to use a more specific code, but sometimes we just don't know a specific code. You add those, and then you can add your CPT codes in, or you can just key them in at the time of. I feel like most office screenings for those are 3, so I would say it would be safe to go ahead and put those, and they can just be changed as needed. And then you add your plan note, if the custom field. I think we may have one for this one. We may not. But you don't have to necessarily do a custom field. You can type in there. I don't know what y'all want y'all to say. Y'all can do this. And that's really all you have to do. So then you just save it. And it's there. Like I said, if you ever wanted to edit it in the future, you can go to the pencil and edit that there. Some other things, that's for templates, some other things that are useful that you may not be aware of is so chart soap notes. This is where you can add things without having to do like a custom field or a template. So if you have something that you typically wanted to add, just something quick, I think. Let's just say parent compliant with treatment plan. And then the area that you want that to be in. So it may be the plan. And so every time I can go into a chart. Let's see if there's one that's open. When I click in plan, it will have this over to the side. So I can do that instead of having to click on this and search for a custom field. The way it was explained to me, these are probably what is easiest to use for your assessments. So if you have an assessment that you typically put, for strep throat, then you can just put it in there. And you can also just create those from within in the chart. So if I'm seeing a patient, right now that would be a good assessment to use for the future, then I just click on this, label it, put it in there, and save, and it saves it for all your others.